Hi guys, welcome back to Let's Go Mental. My name is Warime. Now, Let's Go Mental is a channel whereby we get to demystify mental illnesses and to create mental health awareness. Now, in today's video, I shall be talking about anxiety disorder, which is actually one of the most commonly diagnosed mental illnesses. And yes, during my discussion with people or interaction with people, I've actually gotten to find out that they do not know that anxiety can actually progress or become severe to the point that now it actually becomes a disorder, which is now called anxiety disorder. And then another reason why I decided to do the video is because for the past couple of weeks, actually 4 weeks to be precise, I have been experiencing high level of anxiety, which have been leading to anxiety attacks and then also getting panic attacks. And unfortunately, it's getting to a point whereby I feel like I'm now starting to sink into a depression because, of course, naturally my thoughts are such that why do I have to feel this anxiety? Why am I getting all these panic attacks? What is going on? So despite the fact that I have all the tools to cope with the condition, which is both depression and anxiety disorder, sometimes I'll find that they're not enough, or sometimes I'll find that the mind will tend to win the battle, if I can put it that way. So what is anxiety disorder, or how is it defined? Anxiety disorder pretty much is characterized by intense feelings of worry and fear over prolonged periods of time. So anxiety in our day-to-day lives is pretty much a very positive thing, because with anxiety, it'll warn you about an impending danger. Say there's an animal around you, you will run. It'll also, anxiety is also good, say if you're preparing for a presentation, you're preparing for an exam, it'll pretty much keep you on toes and push you to prepare yourself adequately for that particular event. But then now when it comes to anxiety disorder, that constant feeling of being on edge is with you every single day, every single moment of your life. What are the signs and symptoms of anxiety disorder? Well, number one is that you get heart palpitations. You can be at a point of rest, but suddenly you just feel like your heart is racing. Number two, you'll suddenly start sweating. Number three, you will find that your palms or the bottom of your feet are tingly. Yeah. Then now another symptom is also that you'll find that you are extremely restless and you're not able to calm yourself down. You'll find that you are excessively fatigued, and now the excess fatigue is brought about by insomnia, because because at night, pretty much you can't sleep because your mind is on overdrive. Your body, as I mentioned, you're having heart palpitations, you're sweaty, your muscles are tense. Tense muscles is also another sign and symptom of anxiety disorder. Another sign and symptom is you'll find that you'll get nausea, you'll feel a bit nauseous, or you'll find that you have a running stomach. Then you will also experience shortness of breath. And then another symptom is also dizziness. You tend to get dizzy. But for the dizziness, that tends to happen, especially personally, the dizziness tends to happen right before I get into an anxiety attack. You'll find now when it comes to an anxiety attack, these symptoms will now start getting worse as you go along your day. And it doesn't necessarily have to be a situation whereby it can be a situation whereby, say, you're in the supermarket and suddenly you start feeling your heart racing, your shortness of breath, you start sweating. So it can pretty much hit you at any point in time. However, these symptoms normally build up gradually. And with anxiety attack, especially if you're someone who's already under treatment or know how to cope with your symptoms, then it is easier to manage. However, if now from the anxiety attack, so there's the anxiety attack, and then there's also what is called a panic attack. Now, a panic attack is all the symptoms that I've mentioned. Is all the symptoms that I've mentioned. However, the panic attack is not a gradual it's not a gradual process, or it's not a gradual attack, if I can put it that way. So for the panic attack, you can move from 0 to 10 in a split second. You can be sitting down and you're talking to someone, and before you know it, you feel like you're about to die. Now, that is the difference between an anxiety attack and a panic attack. How do you help someone who's going through a panic attack? One of the things you can do is hold the person and rub their back or rub their arm and just tell them everything will be okay. And then you can also now remind them to do the breathing exercises. Because you see, as much as this person knows their coping strategies, when they're currently in that, when they're currently in the panic attack phase, like they're not able to remember exactly what they're meant to do to reduce these symptoms or to get over the panic attack. So it's important now to remind them to do the breathing exercises, just hold them and tell them to calm down, and yeah, just support them through that whole process. Now, I've just mentioned about coping strategies. Once you've received treatment, or how can you cope with anxiety disorder? The first thing is to watch your diet, watch what you eat, make sure you eat healthy. Number two is don't take caffeinated drinks, which is like coffee, the Red Bulls, you know, the energy drinks, and try and take drinks that pretty much calm you down. So whether it's in the morning, avoid the coffee, substitute it, say, with a warm cup of drinking chocolate, because drinking chocolate pretty much calms you down. What I do personally, I take hibiscus tea, which really helps me when it comes to anxiety. And then in the evening, I also take chamomile tea, which helps me completely calm down, and I'm able to shut down and sleep. Then another coping mechanism is breathing exercises. If you're feeling anxious, just step back, sit upright, extend your stomach, put it straight, and then just breathe in. Breathe in, hold your breath for about 7 seconds, and then breathe out with your mouth and exhale completely. And then now breathe in again. So I shall do it properly. Just breathe in. So you can do that for maybe 3 or 4 times, but also make sure not to make yourself dizzy, because sometimes I tend to do the breathing exercises because I'm panicking, that I do not want to get into an anxiety attack, that I tend to overdo it. So just do it calmly and slowly. I've also learned how to do it even when I'm in a circle of friends. I do the breathing exercises quietly, and then I eventually calm down. And if it does not work when I'm surrounded with people, I will always step aside, maybe go to the car or go to the bathroom, do the breathing exercises, and then I'll go back and join people. And then another coping mechanism is meditation or doing yoga. Now, of course, from a Christian perspective, there's a lot of, it's a bit of a controversial topic, though personally I've done yoga, and which really helped at that point in time. But now what I do is that I meditate on, there are a couple of videos on YouTube where you can meditate using the Word of God, and that is what I personally use. Then how is it treated? Anxiety disorder, once you're diagnosed by the doctor, it is not a physical examination. Yeah, the doctor will pretty much take you through a set of questions just to get to understand exactly what it is that you're experiencing. Then once he's able to identify once he's able to identify that you actually are suffering from an anxiety disorder, then he will suggest what treatment to put you on. So the first one, of course, is medication. Now, of course, it also depends. If you have a mild case of anxiety disorder, then you do not have to be put on medication. But if your case is severe, then it is advisable to be put on medication. Another treatment for anxiety disorder is going to see a counselor, so that you can go through therapy sessions. And one of the most commonly used form of treatment for anxiety disorder is CBT, which is cognitive behavioral therapy, that I shall be discussing in another video. So what are the causes of anxiety disorder? So pretty much just like any other mental illness, they have not been able to identify an exact cause for anxiety disorder, but some of the factors are, number one, genetics. So say if you have a father or a mother who have high anxiety level or have experienced anxiety attack, or a grandmother and an auntie, you're more likely to experience anxiety, you're more likely to get anxiety disorder. And then the second thing is environmental factors. Say for example, as a child you were sexually abused or you lived in a violent environment, you'll find that as an adult you'll tend to have more higher levels of anxiety than a person who lived in a more comfortable environment. So guys, pretty much I believe I've covered on anxiety disorder. I really hope that I've been able to help you and educate you further, because that is the whole point of this channel. And this is the last video before Christmas. I hope you guys will have a lovely time. Remember to reach out to your loved ones, have fun, enjoy the food, and we shall see you during my next video right before the new year. So guys, thank you for tuning in. Make sure you subscribe.